Thank you very much. The Book House Education Trust of Nigeria, which we ordinarily call BET, is an affiliate of the CISEC Foundation, a non-profit foundation based in the US. What we do at the CISEC Foundation is to see how we can wipe out illiteracy in Africa. And me being a Nigerian, I think Nigeria is the best place to start the kind of cleanup that is necessary. Well, the vision of Book House Education Trust of Nigeria is to wipe out illiteracy in Nigeria and develop the people into a reading society. We all know that Nigerians don't like to read. The reading culture is one of our focus and goal, to see what we can do to make books available cheaply, free of charge, and encourage them to cultivate the habit of reading. Well, we will not claim that we have made some progress in the area of publishing, because we don't publish. We merely collect books, donated books by people who have read them and have no need for them. And I want to give you this example. For example, we take books from institutions on subjects that are relatively stable. We take books like dictionaries, encyclopedia, contents that are relatively stable. I want to believe that 2 plus 2 in Nigeria is 2 plus 2 in America, except in binary. No book is useless. No reading book is useless, except the content is objectionable or obscene. Reading books that can edify people, where secondary school children can increase their vocabulary, can increase their knowledge and skills in the language.
Sky High Medical Center, thank God, we started it December 12, 2006, but we were not in total operation until January 1st, 2007. Yes, we started here a few of our teams, and we thank God today that we have increased very well. Our range of services here, yes, we take care of all patients, children, adults. Yeah, we also do maternity, antenatal, we do immunization for children, and of course, we also do very well as per primary and secondary care. Counsel, and then we refer patients when it's necessary to the tertiary center. Our mission primarily was to bring a medical center to the community for easy access and at affordable prices. We are also to take care of primary and secondary care of good quality. And as per our vision, we are to set up a medical center by excellence and exceptional quality, and also to provide unparalleled service in our community. Also to provide enabling environment for work and for practice of medicine. Core values in summary is compassion, empathy, and integrity. Well, corruption is a bane in our society that has to be tackled, and in doing that, we need good leaders, not just dealers, as is very common nowadays. We need that very single person as a leader that will show example, and all the lieutenants around him will follow through.
Well, I started Sajeto Optical Center and Eye Hospital in the 90s, and then it was a clinic, so we called it a center. But when I retired in 2005, I decided to have an eye hospital, so we now register it as Sajeto Optical Center and Eye Hospital, so that it will deal purely with eye matters. Well, what is unique about our hospital is the fact that, you don't have many eye hospitals. Usually you have eye clinics, but to have a full eye hospital, there are not many. So what we do is we give specialist eye treatment, medical, surgical, optical, and preventive. In other words, anything that has to do with eyes is done here. My vision when I founded this is to be the bus stop for eye care in Nigeria, or one of the bus stops for eye care in Nigeria. That is where, when you have an eye problem, you go there and all your problems will be solved. And we are still working on that. But our mission is to ensure that people who can afford it, who want medical, surgical, or any type of eye treatment and cannot afford to go to, public institutions because of the bureaucracy and because of the time, can come to us and still be served. As a doctor, we are not supposed to advertise, but our core values here is that, we practice specialist level. In other words, if somebody comes to us for eye care, we give the best. And if we find that patient, for instance, has other ailments like hypertension, diabetes, and so on, because there's a lot of relationship between hypertension, diabetes, eye, we ensure that they have specialist treatment. In other words, we will direct them to see a cardiologist, direct them to see a diabetologist. We practice as specialists and we encourage our patients to have the best, because the best is available in Nigeria if one can afford it. Well, I think it will be expensive because many people want the best. I'm sure you will want the best, and if you want the best, you have to pay for it. So the best includes getting going to a place where you have the best equipment, where you have third generation drug, or fourth generation antibiotics, and all these things cost money. And I don't think we've started manufacturing equipment as far as I is concerned in Nigeria. So we have to import them. So if you have to import your equipment, you have to import your drugs, then people have to pay for it. So it will be expensive. Before I go to that, I think if we talk about the NHS in Nigeria, we should talk about the HMOs, the health maintenance officers. Well, the idea of having HMO is quite good, but it's a pity that many of the HMOs are not medical. And because they are not medical, they don't understand the nitty-gritty of, what healthcare delivery to a patient should be. When you come to see me as a patient, the interaction is between me and you as my patient. It's not a matter of giving me 100 patients to see and then say, all right, this is how much I will give you. If you come to me, I should be able as a specialist in my field to give you the best.
It's a mixed grill, if I will use that word. Nigeria has progressed in the health sector, but you cannot divorce the health sector from the general economy. That's a major factor. Infrastructure. For instance, we have challenges with light. That also affects the health sector. We have challenges with procurement of drugs. That affects the health sector. For instance, most of the medications we use in our environment are sourced abroad. One of the things that will help us is if those things are manufactured here, it will help us. It will also cut down the issue of fake drugs, because we don't have control over what is coming, even though NAFDAC is doing a lot, but we don't really have control over what they are sending to us. We need to create an enabling environment where those things can be manufactured here. Then we can oversee and ensure that they meet up with standards and regulations.